Dr. Youngson and his spouse, Meredith, have agreed to join us here in the heart of the continent. So without further ado, Robin, the floor is yours.
What I'd like to talk about is something that I didn't know at all about when I first trained as a doctor at medical school. I was trained in an ideal of clinical detachment. We were told that you needed to remain separate from your patients, not to have a connection, for two reasons. The first is that if you had an emotional engagement with your patients, you would not be able to make objective decisions. And secondly, that because you were going to see your patients suffer and go through loss and see people die, that if you had an emotional connection, that would drain you. My wife, Meredith, and I, we've launched a movement called Hearts in Healthcare, which has the purpose of strengthening compassion and caring in healthcare anywhere around the world that we can find people passionate about this cause. Our daughter Chloe, 9 years ago, was driving to university in a small Toyota. She crossed the center line and crashed into a large truck coming the other way, and her car was turned into one of those wreckages where you could not tell what kind of a car it is. That was kind of a milestone, her 3 months in hospital with a broken back and a broken neck. And she's recovered well now, but that was when we thought, we don't have any choice now we have to change the system. We got the phone call that every parent dreads. So Meredith got a phone call from the police to tell us that our daughter had been critically injured and was being rushed to hospital. I was in the OR, Meredith phoned me, and I'm sure the blood drained from my face, and I found someone to cover me, and I rushed to the hospital. And we waited for a long time in a horrible room, which was a waiting room in the trauma unit, and it was a windowless, white painted room with no comfort at all. And what was strange for me was that this was a hospital where I had worked as a senior anesthesiologist for many years. This is a really familiar place. This is a place where I felt at home, confident of my role, and yet on that day, this familiar environment became frightening and alien and horrible, and my role had changed profoundly. Now my role was the very frightened parent of a critically injured child. The clinical care was really excellent. It was in a major hospital. The neglect of her basic emotional, psychological needs and getting good food that she needed for recovery and things like that was profoundly shocking. So we decided to take action. You know, to be honest, we don't remember very much at all about what was said to us in those 3 months. But the things that will stay with us are the emotional memories of those events. We have founded an international movement we call Hearts in Healthcare, and that has the purpose of humanizing healthcare and strengthening caring and compassion, not only for patients but all those who work within healthcare as well. And our strategy is not to try to persuade anyone at all, but we just reach out across the whole world, and anyone we can find who's passionate about this cause or is doing some work, we try and reach out to them, go and visit them, connect up. We have a website where we're inviting health professionals and students and patient advocates and many other kind of health leaders and all sorts of people. Come and join the movement, share information, share stories, share inspiration, learn from each other. Let's create a movement across the whole world to humanize healthcare. If I come into a room as a physician and if I'm distracted or angry or judgmental or not making a connection, my patients don't have clinical detachment to fall back on. We still is an intimate connection, but that then becomes a wounding response. And the influence I have on a patient is to increase anxiety and fear. The lecture today really reflects deeply on the way that I have changed as a physician, because I was an engineer first, and then I trained as a doctor, then became an anesthesiologist. And I worked in a big teaching hospital, so I had a very technical approach to medicine. I was lacking in some of the kind of human and communication and connection skills. And I think over 15 or 20 years, my practice has changed very profoundly, and I'm now much more skilled at making the human connection.
And I truly believe that the common thread in all of this is finding our common humanity, being as kind and caring for one another as we would want to be cared for. And the examples that he gave of the anesthesiologist coming into his own hospital and feeling it was foreign and hostile territory tells me that we have to be aware of those little hidden parts of our institutions we think are clean.
The answer is in working together and trying to break this kind of fixation we have on efficiency, that we are spending more money for less results, less caring, less compassion. How do we go back to the founding origins of compassion, which are rooted in Catholic healthcare for sure, in charity and giving and love for patients and for one another? How do we treat one another better? How do we create healthy communities or healthy environments that allow people to fulfill their vocation? Healthcare is a calling. It's a gift for us to be able to care for other human beings.
And a year ago I published a book called Time to Care, How to Love Your Patients and Your Job. And what was surprising to me in all the research for this, all the scientific evidence shows that first of all that healthcare has in many ways become quite dehumanized. It's turned into a production line where we have a focus on tasks rather than caring for whole people. It's become a hard place for people to work. Many doctors, nurses, therapists are burning out, getting cynical. It's just becoming a drudgery, a job, and many are leaving the profession. So this is really surprising. In the research in my book, Time to Care, this really surprised me how powerfully people's emotional and psychological well-being affects really important clinical outcomes, and the number of studies on this, and this was very surprising to me. So this is a very large study in the Netherlands, 999 survivors of heart attack, older people. And they were followed up for 15 years to find out who has a heart attack, who has a stroke, who survives, who dies. And in the course of cardiac rehab, they did a psychological evaluation, a questionnaire to find out, are these happy, optimistic, hopeful patients, or a middle group, or pessimistic, anxious patients? And the pessimistic, anxious patients, they had 4 times the mortality rate, 400% increase in mortality compared to the optimists. That is an astonishing difference. That's about 10 times the effect size of the drugs that we normally use to treat heart disease. These are really powerful effects. So I've become aware of how profoundly important it is as health professionals that we look after the whole person and we attend to the emotional, psychological well-being, that we take a lot of time and trouble with the connection. When you feel so vulnerable and so afraid, what affects you profoundly and what you'll remember forever are the small acts of kindness and compassion. Compassion is revealed in the smallest of acts of kindness. And on the journey to the CT scanner, there's a joint in the floor between 2 buildings, and this wonderful nurse, he stopped the gurney and he lifted each wheel individually over the joint in the floor so that our painful fractures would not be jolted. And that was 9 years ago, and you can see how powerfully the memory and the emotion of that still plays out in us. And this is what happens in healthcare. The emotional memories of healthcare, for good or for bad, that are wounding or healing, stay with people. And that is a very powerful response.
Je pense que les leçons qu'il nous a montrées aujourd'hui, elles sont universelles. Cette idée de compassion, elle est partout. Puis il parlait, puis je ne sais pas comment réveiller la compassion chez les gens, parce qu'on l'a tous à l'intérieur, mais il parlait du fait que la graine est déjà plantée, mais il faut juste la nourrir. Alors oui, absolument, on peut. C'est une structure qui peut marcher dans n'importe quel, que ce soit en business ou dans les écoles, oui, partout.
The reason that we're here is that our strategy in the movement is to only go to the places where there's already a passion for this work, where you already have leadership. And this place here in Winnipeg that is actually one of the world leaders. You've been on this journey for a number of years already. And really part of our purpose is to come here and learn what you're doing and share that with the rest of the world.
And I am part of the movement, and it just makes me really proud to be among such wonderful colleagues who are doing such amazing work.
Thank you very much for listening so well.